Hello, everyone. Welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we help each and every doctor with his or her career growth. And we do that by discussing journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Akshay, with us, who is here to discuss about his branch emergency medicine. He has had a very interesting journey from practicing in India to moving to UK in the Oxford, working there in the hospital. How is it that he has managed to go there? How has his experience been here as well as there? Why did he plan to go there, and how has his journey been till now? So let's welcome him to the platform. I'm sure this will be very interesting. Welcome, doctor, to the platform. It's really nice to have you here.
Hi, Ayushi. Thank you so much for having me here. I think it's a pleasure to be here, and I congratulate you on your cause. If it helps the budding doctors or just increasing the information and knowledge sharing between doctors for good, it's a very good cause. And yes, so thank you. My name is Dr. Akshay Bhargava. And I am currently working as a clinical fellow in Oxford University hospitals. Although, as a disclaimer, whatever I say on this channel, it does not hold any institutional views. These are all my personal views. So you have to say all these. Yes. And so it is just about probably just sharing my experiences and my love for my field on this platform. So well, let's go for it.
Definitely. So this is your journey that we are really interested to understand on, and your views regarding emergency medicine. So let's start from the start. After your MBBS, how did you get that interest into emergency medicine, picking up a branch which is not really that popular in general, picking up for the post graduation? So understanding that you want to get into it and then pursuing your branch, how did this happen?
So as such, emergency medicine by itself is a fairly new branch. It is now a recognized branch. It was probably the last as a specialty to be recognized by MCI that it's a specialty branch. And it has come, I think, around 2010 or maybe later than that. I don't know the exact, but somewhere around that period when it was it started gaining some recognition in India. So I made my entry into it in 2013. And while I completed my MBBS in 2011. So the field being new, but it sounds very nice, emergency medicine, but the field itself being new, it wasn't very, it doesn't become your first choice because, when students are at, when a field is emerging, when it is new, so people know less about it. And that is the reason why a lot of the people who have started doing, when they started doing it was not as a matter of their personal choice, but when they start excelling into it or when they start loving it, they often say, and it is a saying, very popular in my last hospital of my first place where I worked in emergency department, which was in Apollo Hospitals, Hyderabad, and where I met a lot of interesting colleagues and made a lot of friends during those formative years. And there was a saying that you don't choose emergency medicine chooses you. So yes, there was a certain romance about it because you're doing something that has is still there is vast potential. It is probably it's just a branch that is recognized, but as a requirement, I think it is as old as medicine itself, as old as the origins of medicine, because emergencies happen all the time, anywhere, and how well you respond to it just is a very important life skill. I mean, there has to be. It's not something that can be you alone if you think that this is I will become an emergency medicine super specialist and I will run things on my own. Say like, my clinic, I mean, you are at the peak of the pyramid, or, at the center of your practice. It doesn't happen here. Uh, you see that this field is people dependent. It is people dependent. There are a lot of people involved. You work efficiently by, you can't work 24 hours, but an emergency has to work 24 hours. So you realize the importance of teams. You are always working in teams, so you realize the importance of working together as a team. You realize that you are, as an emergency medicine person, you just doing your job is just one part of the entire cycle. And so there are so many other factors, like the patient, how is the patient received in the hospital, the nursing care, the other specialties involved. So it changes your perspective about all the fields. You get to see all kinds of different cases in this field, and probably at their worst. So these are very fun bits, I mean, and most challenging bits. But emergency medicine by itself, like, as I said, it is a skill set which should be owned by the people. People at a basic level should know how to manage some emergencies. That's a basic need. आपके घर में कुछ होता है तो आपको लगता है कि yes, I should know something, at least कोई भी basic आदमी. अभी COVID times में this has been like lack of proper knowledge has led to half knowledge is like worse, dangerous. So people have felt the need to know at least some basic things of managing a crisis in emergency. Then every doctor then was, no matter what their specialty, had to work in an environment which was unknown to them, and challenges unknown to them. So as such, managing emergency is not just the it is limited to the person who is specialist in emergency medicine. Yes, I mean, you can become a specialist in emergency medicine. I probably can handle a lot of all the different kind of emergencies, probably better, or I have more understanding, and that is my experience in just managing and dealing and preventing and managing an emergency more than. So that's why I may be a specialist in this field. But emergency medicine by itself, or managing an emergency, is I think it is a generality. It is a general, it is a basic need. So I think the field and the need for it has always been there and has been felt by all the specialists. And but to now have it in a specialized structure, and it is developing. We'll speak more about it. So yes, it has its challenges too. So I think I just gave a larger view of what the field is. So basically, how I chose emergency medicine is kind of a bit funny. I mean, I was not the most dedicated of students during my MBBS, because I became lost with regular tests, and I didn't understand why were we doing this. Like, I kind of lost the purpose of it. Then I going through those, it was the way that medicine was approached, or I couldn't find the purpose. So I thought I'll do something else, like, management and things. But it was just during my initial internship phase when I started just seeing patients. I just felt it is, just being with patients and talking to them is such a nice thing. And they're having those kind of conversations. So I thought, okay, let's try to become a doctor. But after my MBBS, after becoming a doctor, I thought of now becoming a doctor. So I thought, okay, what's the way now? So let's start preparing for those postgraduate exams. And at that time, when I said, the fields that, people look for are the fields which are most yielding probably at that point of time. So cardiology, orthopedics, radiology, and all these things, start coming up. Okay. But then I felt, yes, I was giving my exams, and I prepared quite, I mean, quite a lot. But there was a fear lurking inside me because I had literally studied nothing during my MBBS days. I just managed to pass the exams. I was that kind of student. So in a way, when people started calling me a doctor after MBBS, I was shit scared. And my worry was, what will I do if someone is dying in front of me?
Yes.
And it was during those times when I was also preparing. Probably the only I used to study all the subjects for exam preparation, like preparing the MCQs and stuff. But there was one subject that I was studying for my own survival, or just to या अपनी इज्जत बचाने के लिए, वो था first aid. So emergency first aid was something that I felt, if I may know nothing at all, but at least this I should know. So I started focusing on that. And yes, the exams are going on and things like that were going on. And it was year 2012-13 when I was, most of the time doing night shifts and preparing myself in the day, in the daytime. And all those things people do. The life after MBBS is not easy. A lot of people will understand, and they must be going through that when they are looking at financial survivability so as to have a job which can at least sustain themselves. I think doctors will understand that कि आप 25 के हो गए हो और अब आपके पास पैसे ही नहीं है, घर वालों से मांगेंगे, और आपने तो इतनी मेहनत करी है. So anyways, so you go through that bit, and I was also working and trying to prepare. But there was this time, I think there was a case in Supreme Court about NEET, whether it should be put into practice or not. And that took almost 6 to 7 months, and I was just hung, like, what is happening? And I had left my job just to be with my family for a couple of months. And because I felt, again, if I go to college and then, or hospital, I will not get to spend much time. But eventually, when it got so prolonged, even my family members started asking me, what are your plans for future? And the result of the exams have not come because it is stuck in court, and court keeps on giving those tariq pe tariq. And 1 month, it's excruciating wait. If your exam result day is postponed even by 1 day, it hurts, right? 1 day, 1 week, it hurts. Yes. 1 week, 2 week, 3 week, 4 week, 1 month, then 2 month, 3 month, 4 month, 5. I think it was an excruciating wait for a lot of people at that time. And then I came to know about this, that in Apollo Hospitals, Hyderabad, there was there were some people who were doing emergency medicine, and I came across, I just came across some people, and I also learned that they're doing pretty well after doing their 3 years or 4 years into this. So, I mean, I was at that time when the results also started coming, but I didn't want to be a specialist now, because I had just developed some genuine interest in first aid out of trying to survive or save my name as a doctor. I felt this should give me some sort. This sounds exciting, and but at that point, my dad, who's an ophthalmologist, and he tried to he used to take me to different colleagues or HODs in the city, so that they could counsel me on what to do and what not. None of them had heard about emergency medicine, and they said, "अरे ये सब foreign की बकवास डिग्री है, ये तुमको अभी बेवकूफ बनाएंगे, और अभी MD MS नहीं है तो सब बेकार है, तुम समझ लो ये सब बेकार का चीज है ये." और अरे कैजुअलिटी का डॉक्टर तो हमारे यहाँ भी है, क्या करता है वो, एक IV लाइन लगा देता है, उसके बाद फिर बुला लेता है, और तुम क्या करोगे यार, ये चीज कोई भरोसा भी है, क्या होने वाला है? So there was not a single positive advice that I got from the people who are actually in the field as doctors. Nobody I could find who was within the field. Yes, few people, but it is very few. Like at that time, they were very, very few. So anyways, taking a leap of faith, not out of massive choices as well. My rank was probably around 2000 or something at that time, which was like, it will get you something, but probably not the कि मेरे को तो एम्स में वो चाहिए, मेरे को वो वाला, या मेरे को तो यही फील्ड चाहिए. तो ठीक है, कुछ फील्ड्स मिल रही हैं, देयर आर लाइक 5-6 ऑप्शंस और व्हाटएवर यू हैव, मे बी लेसर मे बी मोर, बट वो नहीं यार, ये नहीं करना. लाइक इवन माय डैड हु वाज एन ऑफ्थाल्मोलॉजिस्ट, बट आई फेल्ट सिर्फ आंख का डॉक्टर and those kind of things. It was like, I'm me being a person that I was at that time. So a lot of things, I think they combined, and uncertainty, the delay in results, my own, the things that I felt about being able to manage an emergency, my own needs.
Yes.
And again, emergency medicine in skills wise, just the skill, just the medical skill part. There are a lot of other skills that come in emergency medicine, but it is quite close to, there is a bit of, medicine, there is a bit of orthopedics, there is a bit of anesthesia, there is a bit of ICU. So you share a lot of skills, and now there are also some aspects of radiology that you have to actually know about every field a little. And as you grow, you become more like, you become quite good at those things. But it was quite similar to anesthesia and ICU in what you would do as such. So sorry, I lost my chain of thought here. I was saying.
So what you were mentioning is that emergency medicine is the crux of all the branches, small. What you understood.
Yeah. So at that point, then I felt, okay, let's go for it and start working there. So and I think I'm very grateful to have joined that department and worked there for almost 4 years after that. And which yes, I was mentioning about this bit the last, that I love talking to the patient. So compared to anesthesia and ICU, you have much more interaction with the patients here, because they are alive, they are in their crisis points. You need to make a rapport, you need to make an understanding. So I think my love for communication also started here, where like, I wasn't very keen about the branches which were like, behind doors, like, microbiology, radiology, or anesthesia. Even like, I felt, what will I speak to the patient if he is already unconscious? So anyways, nothing against any specialty. All specialties are fabulous in their own ways, but this felt like this is everything. Yeah, it's on a platter. Okay, let's go for it. So then in July 2013 is when I joined emergency after all of this.
Great. Nice to know about your choice and how did you do that. So now when you are into it and you have been since then till now, it's 2021, how do you see things changing, as well as you have changed countries as well, so how do you see things evolving, things changing, and what is it that you want to, tell the future students to understand how is the future coming with emergency medicine?
So first of all, I think things have changed very rapidly on an exponential basis. There are multiple, the hospitals as such and the government as such is also recognizing the need of establishing trauma centers and 24/7 emergency care and emergency departments. In fact, from the national body, which is NABH accreditation body, it mandates that you should have an emergency department. And for emergency departments by itself, it has maintained some basic quality standards. So from the government, even to colleges, now colleges need to have. So it is what is happening is that there is a need. I always felt like, in smaller cities where the system of casualty, when I started learning about emergency medicine, I realized that there is so much the main damage is done within the first hour of an acute onset of illness. And if you do not know how to stem that or correct that in a right way in the initial bits, you have literally like lost the patient. And which is, I think, I couldn't, after joining emergency medicine, I just, when I looked at other hospitals or other cities where it was not so developed, it it appalled me. It was it I thought, what is going on? Why is this not there? Like the perspective just changed. Like I told you, the perspective of those doctors who have, been, they were ophthalmologists, or they were, whosoever they were, those or medicine specialists, or they gave, or even orthopedicians. So they felt that they knew how to just manage, but they're only their bit of emergency. So people and their perspectives and their worldviews are very different and limited. So it is now a groundswell need for emergency medicine and emergency departments to be there in the hospital, that when you go there, you have someone who gives you treatment right away. In fact, there is now a lot of emphasis on point of care or pre-hospital care treatment being given. And has COVID has emerged, like teleconsultation, and how the balance and home care, and these kind of services which are coming to closer to the patient. You are, as I was mentioning in our previous conversation about this book, The Patient Will See You Now. Like, it's not that the doctor will see you now, the patients are waiting outside in the waiting room. Yes, that is there, and that will, it's not like it's going to change. But now everything is, the healthcare has started moving towards the patient. Patient has more accessibility. Patient can, so no matter what, how much we think it is right or wrong, but it is going to be the shift, the technological shift, the how. And because it is not only about medicine, this is a change at large. Like, if you want to do shopping, you just don't go out to the retail shops anymore. You do a lot at home, which was something unfathomable before. So people, food getting on your home, delivered to your home. So as more and more services become more accessible to people sitting at home, they want healthcare to be also like that. So a lot of, when we look into future, and the people who are looking forward how healthcare is going to change, so there it is going to become closer to the patient. And so there is a huge need of people being told or being guided at an early level in terms of what their disease, where should they go to. Like, specialist will be there, specialist is, but at the basic level of need and the basic level of healthcare, you can't even imagine what it is there in villages. Like, people are just dying right and left because of lack of accessibility in some places, or lack of emergency care. So emergency care in the hospital, like at the doorstep, before that pre-hospital care, like, or emergency, patient calls for the ambulance and it arrives.
Yes.
Before that, and then as we look at the shift, so emergency, pre-hospital, then providing home care and teleconsultations, then looking at preventive and well-care aspects. So it is, and preventive aspects, because that is an overall wellness. You are seeing that trend already there, and I see that as that is going to be the shift. So medicine is changing very rapidly. In fact, I think the MBBS curriculum is also changing. It is becoming more competency based. It is becoming that more that it should make you prepared for the real life in a manner. And in COVID crisis, we've seen even the final year medical students being pulled to do the COVID duties in a lot of places.
Yes.
And imagine, I would like, when I was at that level, I, I, I mean, people think that just being in medicine or a person completing MBBS, he will know a lot. It is not so. They have not come across, they're still kids, and they have learned a lot about, a lot of information has been fed into them, but how they should act when a person is having, who just falls in front of them, uh, breaks a leg, has a cardiac arrest, has a stroke, uh, what to do in that particular thing. So it has to be developed, as a need itself, as a common thing in basic education, MBBS itself. And then, of course, it has to be specialized, the people who will lead the departments. So emergency medicine, by the scope of the field, is increasing a lot. So a lot of people, as you asked, that who are thinking where they should go or what should their views of this field is. So I would say, don't worry about what this field will offer you or the scope of it. There will be a limitless scope. Scope will depend on what you can do and not limited by the numbers of things.
Correct.
And you will realize that, as I said earlier, it is not you alone who, if you become a super specialist in emergency medicine, but if you are working in a third tier city or second tier city in a district hospital, where no facilities or no support staff, you won't be able to do, you will make your life hell if you say I'll be available 24/7. You have to make a department 24/7. So as you grow in the field, your growth is determined by how well you develop the processes and the place itself, the department itself. So people, process, and the place is what makes the department as a whole. So your growth will depend on a lot how you educate other people, how you manage the department, and how you and bring innovation, because this, you will see that you will be the link between the janta outside. You are at the doorway of the hospital, and you are the connection between all the specialists and the hospital management behind. So your performance will be affected by not only the people and the problems that they are coming with, but also the resource being provided by the hospital. So management as such also starts playing a role, but that is at the higher level.
Yes.
In the initial bits in your training, you should focus on becoming a better clinician and to be adept at managing any sort of emergency. And there are courses that have come up into it which we can speak about, but don't worry about the scope of the field. The field will offer you a lot. You will think, what should where should I stop? But there is a lot to do. So if you have a hunger for and a rage for those, some exciting, and it is a very exciting field. And the good thing is that the shift always ends.
Yes.
So after that, you're not carrying itself with you, but yes, that's another aspect. So yes, it's a very exciting field.
So now when you were mentioning about courses, so there are different kind of courses available. Before, obviously there were not MDMS available, but now there is MD also, DNB also, then there is MEM also, a Masters in Emergency Medicine, then there is MRCEM also. So when you are in UK, you understand by the Royal College of Surgeons, there is MRCEM also. So what is it that you will suggest people to to pick up if they want to specialize in, and what is the importance of different courses?
So as I said, you've rightly pointed out, largely these are the four varieties of courses being available in India. I think the MDs and the DM are through the central government exams, and you have to see which state. A basic thing is, yes, MD and DNB are traditionally recognized throughout India, so that is in terms of recognition, it has it has already the national approval. So these are recognized degrees. These are the degrees that postgraduate get in India. So if you get either of those, well and fine.
Yes.
But then there are like I have a membership of the Royal College of Emergency Medicine, and it was basically through an exit exam. Say what it needs is that you have worked for certain time in an emergency department. You have managed to gain some competencies for which evidence you can build up through a logbook or a portfolio. And they provide you with you can find how to build up your portfolio. See that I have seen all these kind of cases, I have performed all these kind of procedures, and so you attain certain bit of competencies and you are able to show that you have certain amount of experience, and so as to be eligible for this exam. And which is around 2 to 3 years, not much, and a lot of people can generate that if they if their internship, and after that if they are working in a place where you are seeing emergencies or acute, so you can generate that much amount of evidence so as to support your I want to give this exam. And giving an exam is not a difficult task, so it is like probably 2 to 3 years of experience is what they ask for. I'm not sure about the particulars, but then when you give that exam, so in a way we've heard about MRCP a lot. Like MRCS is a very I think it is a more junior level exam. MRCP is kind of considered equivalent to MD in India in a lot of places. And I think MRCM is at the same level, because either of those exams, I think you get a middle grade, a registrar level job in UK, which is like, to understand the grading in UK, it is like consultants, middle grade registrars, and which are like associates to the, and then there are the senior house officers, the SHOs, and so that's how it is here. So you do your MRCM. Sorry. Sorry. Yeah. So yes. So if you do that, so MD and DNBs I think are through the NEET. The RKM allows you to give an exam and get a qualification. Yes. It's as simple as that. But you should just be able to show that you have some experience of working in an emergency department of around 2 years, or some in critical care setups and stuff like that. So you are able to do this and that. And lastly, about MEM. Now MEM, along with a lot of there are other DEM, FEM, and these kind of fellowship or diplomas. Now, as per my understanding, that they are not as such recognized by a body in India, but what you see is a lot of these people have, and including the people who do their MRCM also, what happens is, say after MBBS, you've not been able to get into, like, you didn't get an MD or DNB in a recognized government college, fine. But you're still working in a hospital, right? When you start working in a hospital in an emergency setup, slowly, you're seeing cases day by day, you get experience, then you have to learn. You should, if your department is supportive and has an academic structure, there is nothing better than that. Basically, when you are choosing to work in an emergency department, you should, as I said, look at those three things: the people, the processes. Are there some processes, some pathways in the department? Because that a lot of things are dependent on developing good processes and pathways in the department, so as to make decision making and patient treatment more streamlined. And how's the place in terms of, and the academics behind it? Is there I think my senior teacher, he once mentioned about His name was Dr. Joshi, and I mean he was the head of department when I had joined, and he used to mention padai, paisa, and so one people as the enablers of the department, if I'm not wrong. So point is, you see that if there is an academic structure, there is someone who, or there are good people who can support you. There is an academic build-up. People are wanting to grow. So where I worked, when I joined, there was an academic supporting structure. Like everyone was looking forward to give the exam. So in terms of they were trying to progress, so they would teach you what they have come across, and it's not like ड्यूटी कैजुअलिटी मेडिकल ऑफिसर की तरह 2 साल जॉब कर रहे हैं और उसके बाद फिर हम पीजी का एग्जाम दे देंगे. People wanted to grow in emergency medicine. So that makes a difference. So if you're choosing a department, see how is there some support about it, and overall which should help you guide and progress in that path. Because there are hospitals in which, like, they have started an MD, but there is in lack of there is no one who is like head of emergency medicine, or somebody who has gone through the journey of emergency medicine. So it is not that they impart you are learning the right things. You are learning as the things have been going on in not a very structured manner. So even if you do MD from say any random college which is not very you may become like a casualty medical officer in a way, because if you were not, the college was not great or the hospital was not great, versus even if you have done a lesser degree, like or maybe not a recognized degree as such, but if you have worked in a corporate hospital which has known to have a very good emergency department. So even people who do MEM or even MRCM, basically they have a certain qualification to show. And a lot of corporate hospitals identify these as degrees that a person, if they hold, they have certain competencies and can manage the department. So the job opportunities for even if you do these are quite it's, you may not get into a government setup, but you can easily get into a corporate setup by showing that yes, you have worked in a corporate emergency medicine department, and you have certain degrees and credentials to prove. It is, of course, so it might not be your first choice, but if you get it, don't worry about it. The future, because of the need of the field, you will grow into it if you are really keen.
Correct. Very nice to know about this. So now, after doing either of these courses, especially MD and DNB, what are the kind of job opportunities that are available in the branch across India?
So I can give you an example about the city of Hyderabad, where a lot of people, I mean, I can share my experience, so I'll tell you what's going on, what happened there. So one department, like where I was, Apollo, I mean, I think it was one of the first places where emergency medicine as a specialty started to grow, and qualified emergency physicians or emergency physicians with certain qualifications started to emerge out of it. So the people who, after getting their qualification, they were being hired by other corporate hospitals to set up their department. So in essence, they were hired at a very, high post. After 3 years, you would probably get, you can become a department in charge.
Yes.
Those kind of, so I mean, the opportunities are quite lucrative, but also understand that a corporate, when they offer you and a high post and high job, they will suck every ounce of blood inside you. So in a way, that is, well, that's what you're getting paid, and it's kind of the field, and it comes with growth. Like with greater position comes greater responsibility, comes greater power. So all those kind of things are there. So yes, there is growth. People could, but now as the years are going by, now departments are getting saturated. Now they can offer you an associate post or So yes, in a way, it's not like, you will straight be, because there is somebody senior already to you who has worked in that hospital. So yes, the market gets a bit saturated that way, but still it is not like, the opportunities are not there. People who have the ability to still break the mold, it is a specialty that breaks the mold. If you can bring certain value to your hospital, if you can show that I have certain methods or innovation so as to improve the patient care, and probably what a lot of corporates will also like to hear is how you can help maintain their patient flow, how you can increase patient flow, or no, it's not like, I want to make more people sick and try to increase patient flow. It's a method of how you can improve your quality in a manner that improves patient care. And as a whole, that should be how you should be focusing on patient care, and that's how you should be trying to improve your revenues and stuff. For me, it always comes, I don't understand that very well. I think it is a very essential aspect as well, which doctors completely overlook. But understand this: as you are growing, you will find opportunities to grow. Even MDs and DNBs, if they have worked in and their degree by itself is a weighted degree. If they have worked, and emergency medicine, every day, it's a specialty that will teach you every day. It is not like, if you have an attitude of learning, the more you work, you will automatically, there is so much happening every day, so many cases that you see, so many cases that you will not know initially. And every day there will be some surprise. I mean, there has to be something. So field by itself starts teaching you. So there is, I say, yes, there are certain degrees that are, this is what it is. MD, DM, MRCM, MEM. But understand that this field has a lot to offer. And if you can adapt with the times and show after you have graduated that you can create some value, you will find opportunities. And how you can do that is, I think people will need, I mean, you can always explore, but yes, you should be a good clinician. I think you should show some managerial skills, able to manage people, manage teams, be some leadership skills, good communications skills, and also a bit of academicians, because you need to be able to train people in order to develop. So apart from just being a good clinician yourself, there are these other aspects that play an important role of how you develop yourself as an emergency physician.
Correct, correct. So correctly said, and so important, to understand before picking up this branch. So now when you mention about different kind of job opportunities, going for corporates as well as the government sectors. So is it that, as emergency medicine is not a well-known branch in smaller cities, do you think there are job opportunities in smaller cities as well, apart from metros with the same? Is it
So yeah, I think you've asked just the question in the right direction from here, because I gave you the example of Hyderabad. It's a major big city.
Yes.
And yes, it is, while over, but it's not like the market has saturated overnight. It's taken 5-6 years, and it's still not saturated. There is still a huge need. The bigger corporate hospitals will still take you if you have a, if you can show them your value, one.
Yes.
And there are still hospitals at the outskirts which are still in need of, give me at least one person who can manage emergencies.
Yes.
And so they are still, now when it comes to, say, tier 2 and tier 3 cities, you should, I mean, anyone should understand that this is where now the next level of influx and the growth is happening. So what probably happened in the city of Hyderabad 10 years ago is now happening, or 20 years ago, 15 years ago, something like that. And it's where now the level 1 cities are. And as I said, because there is a great push by the government, by national bodies, state bodies, that because there is an outcry from public
Correct.
कि लोग इमरजेंसी के बाहर मर रहे हैं, या ये अगर इमरजेंसी केयर नहीं है अच्छी, so there is a huge outcry about it. And yes, in an outcry basis, we are also seeing that public is sometimes anguished by what happens, and if they do not get good care. But I think apart from the good care, we cannot never justify if you are showing your anguish through violence in hospital. I think that is completely unpardonable. But what I'm saying is that there is a continuous need of providing good emergency care in hospitals, and that is even more now. People even in tier 2 and tier 3 cities are becoming more woke, or aware of what is they have access. Everyone now, आप पहले अपने गांव में अगर आप मुखिया थे तो आप दुनिया के शहंशाह थे. टाइम बदला, 50 साल बीत गए. अब इवन आप अपने देश में सबसे महान काम कर रहे हो या अपने शहर में सबसे कर रहे हो, यू विल ऑलवेज फाइंड समवन जो आपके ऊपर है. तो ये दुनिया को अभी टेक्नोलॉजी से ये भी हुआ है कि मैं मतलब who's playing the biggest game. So people even in the 2nd or 3 tier cities are aware of what is happening in bigger cities. They are also getting food at their doorsteps. They are also getting deliveries at their doorsteps. So times are changing for them also. So I see no reason why it will not be a growing opportunity in these places. And if you start, if you say I'll settle and I start working with this hospital, you start working with that hospital, and you see a grow, you develop the department, and you will see with your growth the department will develop, and vice versa. So yes, I mean, and there comes an age which we can also talk about later, that yes, you feel that you probably may not be able to do night duties and stuff. You're very comfortably able to do them in your 20s, somewhat comfortably in your 30s, may not be able to do very comfortably in your 40s. And after that, I don't think so it is very comfortable at all. So yes, people, it is not like कि आप जिंदगी भर करते हो night duties. ये I think एक बहुत बड़ा fear होता है लोगों का. Yes, your times are a bit erratic in terms of emergency medicine. Kabhi day duty, kabhi night duty, kabhi afternoon duty, and ये चलता रहेगा. This will always be there. And I have also worked for 2 years in a 9 to 8 to 5 or 9 to 5 kind of setup, and I totally missed the coolness that I felt after coming from a Wednesday night shift or a Tuesday night shift, and Wednesday morning world is going this way, I'm coming the other way, and thinking, मतलब you feel different from the crowd. मैं आज सोऊंगा और मैं वेंसडे को मूवी देखने जाऊंगा या मैं मंडे को मूवी देखने जाऊंगा. ठीक है, मेरे पास सैटरडे वीकेंड हो सकता है पे कभी काम कर रहा हूँ, एराटिक टाइमिंग रहते हैं, बट आपको ऐसे ऐसे टाइमिंग्स के भी आपको टाइम मिलता है क्योंकि आपकी शिफ्ट खत्म होती है. और विद टाइम जैसे जैसे आप ग्रो करते हो, जैसे अगर आपने ग्रो करके डिपार्टमेंट को बढ़ाया, तो अगर आपने इतनी कैपेबिलिटीज कर दी कि आपको बस ऑन कॉल हो गया, आप है ना, आप ऑन कॉल हो गए, या जूनियर स्टाफ या जूनियर डॉक्टर्स जो नए डॉक्टर्स आए हैं, दे आर एबल टू मैनेज द डिपार्टमेंट इन द नाइट, सो दे कैन simply call you for help if required, and you can do that. So if you develop good people to run your department, you can still grow with seniority and not always और मैंने देखा है कई सारे जो भी फिजिशियंस हैं, यहाँ पे भी जो कंसल्टेंट्स हैं इमरजेंसी के, आफ्टर 40s or 50s they have taken up roles which absolve them of the night duties. I mean, in fact in UK also getting a consultant to cover for the night is not often. I mean, it is rare rather. So it is only when there is a utmost crisis is when consultants are called. Otherwise they're managed by the registrars. So I mean, there is a progression, and you after you have done your your MBBS, आपने अपना पोस्ट ग्रेजुएशन कहीं पे भी किया, आपने कोई भी डिग्री करी, ठीक है, आप एक इमरजेंसी फिजिशियन बन गए, आपको एक फर्स्ट जॉब मिलेगी, उसके बाद you try to take a 360 degree view of your life कि अच्छा अभी तक तो मैं पढ़ रहा था, अब देखते हैं क्या करना है.
So now when you mention that there needs to be process, there needs to be people, it is not a one person job, it's a system altogether. And then you mentioned that things are also coming up in tier 2, tier 3 towns. Isn't it difficult to set up systems there? If I think कि मैं एक tier 3 town में एक hospital में एक system set करना चाहती हूँ, isn't it difficult for a doctor to take that responsibility to then hire people there, make a process, make a team, work on this? Do you think it is this works? So this is a very personal question that I feel. So
it is not personal. It is it is not a personal question, Ayushi. Just to correct you on that, I think I did tell you that I have spoken to the most senior of the doctors who are also at level of Padam Shri and those, and head of departments, and some who have owned hospitals. And when I hear some of them share their pain, if you don't know how to manage yourself, somebody else will manage you.
Correct. That's true.
And they feel like the things that I told you, like when you have to grow in emergency management, academics, research, teaching are things that you find your growth in.
Yes.
Even in patient care, but I mean overall that's what you're trying to achieve. But your question is कि एक डॉक्टर के लिए कितना आसान, तो आसान नहीं होता है. एक खासकर एक नई जगह को सेटअप करना is never ever easy, क्योंकि जब आप कोई एक नई जगह को सेटअप कर रहे हो ना, तो एक तो क्या है कि इट्स लाइक अ स्टार्टअप जैसे. आप उसको मैनेजमेंट, कोई भी आप एक आजकल कोई अगर डिग्री कर रहा है फिर अपनी कोई चीज सेटअप कर रहा है, तो हमने ये भी बात करी थी कि हाँ, आई मीन इफ यू आर डूइंग ट्राइंग टू मैनेज समथिंग, सो वेदर इट इज अ चेकलिस्ट वे दैट यू आर डूइंग इट, और यू आर ट्राइंग टू फाइंड smoother and better ways to do a thing, you always are trying to better yourself, which is like आप कुछ करने की कोशिश करते हो, फीडबैक आता है, उस फीडबैक को असेस करते हो, फिर क्या चेंज करेंगे, and you keep on try to you set a goal and you are trying to achieve it in different ways, trying, if it's not working, again thinking how it can be improved. Yes. So essentially management is a task of getting things done.
Yes.
Is the art of getting things done. You can be an artist about management, but the problem with medical education and doctors as such is that they have one thing: a patient की gut में क्या हो रहा है, उसकी blood vessel में क्या हो रहा है, क्या ट्रीटमेंट देना है, क्या डोज देना है, क्या साइड इफेक्ट है, बस उसी के ऊपर पूरा फोकस रहा. पेशेंट केयर के ऊपर बाकी एस्पेक्ट्स को उतना कभी वेटेज नहीं मिला. सो एज सच व्हेन दे एक्चुअली कम इनटू देयर रियल लाइफ, एंड फॉर एग्जांपल इवन इफ इट इज नॉट इमरजेंसी मेडिसिन, if it is any other specialist who is trying to set up their own clinic, if they want to be the boss, they will have to learn to manage this.
Yes.
So it is I mean
it's a part of
आप मैनेजमेंट में डिग्री लो ना लो, आप मैनेज तो करोगे ही. और छोटे शहर में जरूर, जब आप कोई नई जगह पे जा रहे हैं, एंड यहाँ पे बात आती है कि अब आप क्वालिफाइड हो गए, ठीक है, नाउ यू वांट टू वर्क, नाउ वेयर यू शुड वर्क. अभी तक तो मैंने बताया, जब आपको ट्रेनिंग लेनी है तो आप ऐसा देखिए डिपार्टमेंट जहाँ पे कोई एकेडमिक स्ट्रक्चर हो, वहाँ पे और भी इमरजेंसी फिजिशियंस हो जो काम करना चाहते हैं, जो ग्रो करना चाहते हैं, तो एनवायरनमेंट में आप भी ग्रो करोगे. जहाँ पे पढ़ाई का माहौल हो, जहाँ पे सीखने का वो हो, तो जहाँ पे पेशेंट्स खूब आते हो, तो वहां पे आप सीखेंगे, है ना. तो पर अब ऐसी चीज, अब आपने कर लिया, आपने पढ़ाई कर ली, अब आपको पेशेंट को मैनेज करना आता है. अब आप सोच रहे हो कि let me take the next step in my life, let me take my first job, or get into into or make my dreams come true.
Yes, yes.
Whether it is job or whatever, like अब मैं तैयार हूँ, अब मैं आ रहा हूँ, ठीक है। तो अब आप कहीं पे भी जो काम करने की जगह अब आप ढूंढ रहे हैं, तो आप ऐसा नहीं कि आप बस अब आप सिर्फ एकेडमिक्स और पैसा या फिर पेशेंट देख रहे हो। ये वो टाइम आता है जब यू टेक अ 360 डिग्री डिसीजन इन योर लाइफ कि मैं कहाँ पे रहने वाला हूँ। मैं मे बी यू हैव, इफ नॉट 5 ईयरली, एटलीस्ट 2 या 3 ईयरली का तो प्लान बना के आप जाते हो ना, या एनुअली तो लीस्ट कोई बनाएगा अगर कोई नई जॉब लेगा कि ये मेरा प्लान है। आप शहर भी चुनते हो। अब आप जगह ओवरऑल देखते हो कि हाँ ये जगह, फिर अगर लोग if at that time you are maybe married or have family, you're also looking at other aspects of survivability or ease of living types. You're looking at those things, and then you're looking at salary. So you look at the place as a whole, जगह रहने के लिए कैसी है, you look at the salary, and then when you go for your first job kind of thing, or the thing कहाँ मैं जॉब करूं, ये एक ऐसा क्वेश्चन है क्योंकि अब आप जूनियर लेवल पे नहीं जा रहे हैं, और ना आपको जूनियर लेवल पे काम करने में मजा आएगा कि आपको कोई बताता रहे ये करो वो करो। अब आप इतना ग्रो कर चुके हो कि आप और आप बता भी ये रहे हो कि ये मेरी क्वालिफिकेशन है, मैं ये सब कर सकता हूँ। आप जितना प्रॉमिस करेंगे उतना आप पैसा डिमांड करेंगे, या आपको उतनी पावर मिलेगी, उतनी रिस्पॉन्सिबिलिटी मिलेगी, है ना। सो इट इज अ गिव एंड टेक रिलेशनशिप, बट ऑफ कोर्स व्हेन यू आर गोइंग फॉर अ जॉब, इट इज वेरी इंपॉर्टेंट टू हैव अ बैलेंस ऑफ दैट गिव एंड टेक, ठीक है। और अपने को उस टाइम पे ये एक मेजर डिसीजन सा होता है जब आप, क्योंकि इट अफेक्ट्स हाउ यू आर गोइंग टू लिव योर लाइफ और प्रोग्रेस इन योर लाइफ। आई मीन डिसीजन पॉइंट्स फॉर अ डॉक्टर आर कई होते हैं कि मैं कौन सी फील्ड लेने वाला हूँ, और है ना, उसके पहले शायद क्लास 10th में मैं मैथ्स लूंगा, बायो लूंगा, काइंड ऑफ क्वेश्चंस। एंड तो उसी में एक ये भी है कि आप, अब मेरा हो गया, ट्रेनिंग हो गई है, अब मैं कहाँ काम करने वाला हूँ। तो आप जो वो जगह चूज करें, अब आप काम करने की जो जगह चूज कर रहे हैं, तो देखिए वो गिव एंड टेक कैसा है, अपॉर्चुनिटीज क्या है, जो लोग आपको हायर कर रहे हैं वो गवर्नमेंट बॉडी है, कॉर्पोरेट बॉडी है। अगर वो कॉर्पोरेट बॉडी है तो उनका क्या विजन और मिशन है, वो कैसे ग्रो करना चाहते हैं, वो किस चीज को प्रायोरिटी रखते हैं, उनके क्या एम्बिशंस हैं। क्योंकि आप you will realize that when you are leading a department or at a senior position in the department,
you need that
you will the resources that you are given, ठीक है, या आप कैसे पेशेंट्स को, क्योंकि आप पेशेंट्स को कुछ अगर ट्रीट करेंगे तो उसके कुछ चार्जेस होंगे जिसको आप ऊपर शो करेंगे, या वो आपको बताएंगे कि मेरे पास इतना बजट है। बजट एक ऐसी चीज है जो मैंने अपने when I after my training and then when I had taken up a different job opportunity, अभी तक मैं फाइनेंस से बिल्कुल एलूसिव था कि ये क्या है, मेरे को ये सब मत बताओ, ठीक है, मेरे को नहीं सुनना, ये समझ में भी नहीं आता, और बस मेरे को मेरी मतलब आई शुड हैव अ डिसेंट सैलरी, बट और डिसेंट क्या मतलब इतनी कि कभी डॉक्टर को कोई बहुत वो एग्जॉर्बिडेंटली नहीं होती है। ये यहाँ पे भी ऐसा नहीं है कि आप यूके आ जाते हैं, इट इज लाइक यू ग्रेड विद द लाइफ स्टाइल, ऐसा नहीं कि आप कहीं पे भी, डॉक्टर आर नेवर ऑब्ससीनली पेड, यस, इफ दे चूज टू develop something of their own, but then they are getting into management and those are other skills that they are honing and bettering upon. My point is, अब आपकी जो जॉब है, आपने कहा कि वो मैनेजमेंट के चैलेंजेस अरे बहुत आते हैं। अब आपका एजुकेशन में आज तक किसी ने आपको बताया नहीं कि ये सब चीजें भी इम्पोर्टेंट है। जब आप अपने पहले जॉब के लिए जाते हो तो आप किस लेवल पे अपने आप क्या बोलते हो कि मैं ये कर सकता हूँ, पर मैं कितना कर सकता हूँ या आपसे कितना काम कराया जाएगा, ये चीजों की अंडरस्टैंडिंग रखना, पेपर और पेन पे क्लियर रखना कि आप so that nobody should exploit you, but at the same time you are also not like a neither you are exploiting them, neither they are exploiting you. It should be a win-win symbiotic relationship that overall is for the betterment of आप अगर पेशेंट्स को ट्रीट करना चाहते हैं तो उसकी तरफ हो. तो छोटे शहर में चैलेंजेस होते हैं, आपको मैनेजमेंट तो पापड़ तो ये बेलना पड़ेगा. आई थिंक अगर आप खासकर इस फील्ड में अगर जा रहे हैं और अगर आपको सीनियोरिटी की तरफ जाना है तो ये पापड़ आपको बेलना आना चाहिए. ये फील्ड आपको सिखाती भी है, आपको टीम को लीड करना, टीम को मैनेज करना, तो ये सारी चीजें हमको इसके इनिशियल स्टेजेस पे ही सिखाई गई थी. और बाकी आप you learn with the things, but आप वहां ये क्योंकि ये आसान नहीं होता है, तो इसीलिए ये भी कहूंगा कि अगर छोटे शहर में जब आप और जिस ऑर्गेनाइजेशन या जिस डिपार्टमेंट में आप लीड रोल ले रहे हैं जॉब का, वो देखिए हॉस्पिटल का मैनेजमेंट कितना सपोर्टिव है. अगर मैनेजमेंट सपोर्टिव है, इंटेलिजेंट है, अंडरस्टैंडिंग है, उनको समझ में आता है कि इमरजेंसी केयर देना बहुत जरूरी है, वो आपके डिपार्टमेंट को लेके सपोर्टिव हैं, तो कई सारी चीजों के लिए आपको बहुत ज्यादा फाइट और वो नहीं करना पड़ेगा. तो ये चीजें कई तो होती है कि आप जब जॉब में जाते हैं तभी मालूम चलती हैं. स्टार्टिंग में एवरीथिंग लुक्स, वो भी हंकी डोरी बोलते हैं, आप भी कहते हैं ऑल वेल, बाद में आती हैं ऊपर नीचे थोड़ी बहुत चीजें. बट एज मच एज यू कैन अंडरस्टैंड what is the management structure, what is the ownership structure, what is their mission and vision, how much importance do they give to a department, what do they want from the department, how do they want to grow the department, how much they are willing to support. If you have a good understanding of all that, तो आप automatically एक ऐसा जॉब फिर चूज कर पाओगे जो कि आपकी नीड्स को बेस्ट सूटेड होगा और आपकी कैपेबिलिटीज को भी जस्टिफाई करेगा.
That's very, very interesting to know and important to understand what kind of skills you need to have.
और मैनेजमेंट की अगर कहीं डिग्री, मेरे को नहीं मालूम, मैंने कोई डिग्री नहीं करी है, पर मैंने जहाँ पे काम किया था अपने फर्स्ट ट्रेनिंग के बाद, मेरे को आई हैड टू लर्न हाउ टू मेक बजट, आई हैड टू डेवलप KRA एंड KPIs. ये पता नहीं यहाँ पे की रिजल्ट एरियाज और की परफॉर्मेंस इंडेक्स के बारे में मालूम चला. टीम मीटिंग्स, कैसे मीटिंग ऑर्गेनाइज करना भी एक आर्ट होती है, फिर टीम को मॉनिटर करना और खुद काम करना वर्सेस लोगों से काम कराना, दोनों अलग चीजें हैं. ये समझ, लाइक इट इज अ वर्ल्ड ऑफ अ डिफरेंस. आज दूसरा आपसे अच्छा काम कर सकता है, पर क्या आप उसको अपने से अच्छा काम करने देते हो, उसको वो अलाउ करते हो, वो एक अलग स्किल है. आप उसको बेस्ट करा सकते हो कि नहीं, तो वो आता है. आपको अगर रात को सोने का है तो आपको देखना है अगर आपकी टीम अच्छे से मैनेज कर रही है, ये तो आएगा. तो मैनेजमेंट मैंने किया नहीं, पर ये पापड़ आप थोड़ा सा अच्छे से बेल लो, नहीं तो आपको बेलना पड़ेगा. एंड either ways, it is management is just a name. As I said, it is an art of getting things done. If you do it artsy way, if you do it intelligently, you will. So don't think if doctors have to proceed, they have to understand कि management क्या होता है, या फिर उनको कोई ऐसा मैनेजर मिल जाए जो कि बहुत अच्छा मैनेज करे और उनकी भी केयर करे. या तो ऐसा हो, नहीं तो आप खुद अपने आप को मैनेज करना और खुद की केयर करना सीख लो, या तो आप, नहीं तो ऐसा कोई ढूंढ लो. ठीक है.
So correctly said, management बहुत ज्यादा important है, and for everybody, not only for emergency medicine, for everybody. So now अब management की बात हो ही रही है, so to understand what are the kind of fellowships or things that every emergency medicine practitioner should learn, should understand, या कोई after post graduation कोई ऐसे fellowships होती है जो आप suggest करना चाहोगे, या on job learning is the best? And
मतलब
when you mention about management, just sorry to cut you down, so the thing is, जब आप management के लिए बात कर रहे हैं, आपको लगता है कि MBA करना फायदेमंद होता है during your studies?
I think it can, because मैंने आपको ये नाम जो बताया ना, ये सारे बजट या ये सारी चीजें एकदम एलियन. है ना, एकदम एलियन। तो ये आपको आप कोई मैनेजमेंट डिग्री करोगे, मेरे कुछ कोलीग्स जिन्होंने हाँ आईएसबी या और भी कहीं से मतलब डिफरेंट, और मैंने कई देखे हैं, कई डॉक्टर्स भी एक दो कर लेते हैं, और जिनको अपना रन करना होता है ना, वो कहीं से एज ए नीड भी कर लेते हैं। तो ये सारी चीजें आपको कोई सिखा देगा, तो वो आप देख लीजिए। अगर आपको कहीं से चाहे सर्टिफिकेट डिप्लोमा कर लो, बट कोई थोड़ा बहुत ज्ञान दे दे, नहीं तो किताबों से कर लो, चाहे लाइव से सीख लो, या कहीं से कोई डिग्री कोर्स कर लो। एक टाइम के बाद ना आई फील कि ऐसा नहीं है कि बस आप ठीक है डिग्री एंड वो एक वैलिडेशन है कि ये मैंने इतनी सारी चीजें करी हैं, पर एक टाइम के बाद हॉस्पिटल ये देखता है कि कौन, व्हाट इज द वैल्यू दैट यू कैन गिव मी, आप मेरे लिए क्या कर रहे हो, आप क्या वैल्यू क्रिएट कर रहे हो, ये क्वेश्चन आपसे लगातार पूछा जाएगा। तो आपने बस कि ये है यही डिग्री, या फिर मेरे को नहीं आता, या फिर वो तो नहीं हो सकता, यू विल, तो थोड़ा बहुत मैनेजमेंट ठीक है सीख लो, नहीं कर सकते तो जैसा बताया कि फाइंड समवन हु कैन और समबडी मैनेजेस यू वेल, बट ओवरऑल दिस इज इम्पोर्टेंट।
और इसके अलावा आर देयर एनी फेलोशिप्स दैट यू विल सजेस्ट फॉर इमरजेंसी मेडिसिन स्पेशलिस्ट्स, टू गो फॉर वेदर इंडिया और इंटरनेशनल?
So fellowship, I mean, probably if I can just divert this question to the subspecialties or specialties in this.
Specialty, subspecialty.
तो इमरजेंसी मेडिसिन की बेसिक डिग्रीज तो जैसे जिनके नाम आपने लिए वो हैं, और 1-2 साल के भी होते हैं। तो एटलीस्ट व्हाट आई एम सेइंग कि कई लोगों को मैं रिकमेंड भी करता हूँ कि अगर तुम इनिशियल स्टार्टिंग टाइम में अगर तुमको इफ यू आर नॉट गेटिंग योर पीजी, बट एटलीस्ट कुछ इमरजेंसी मेडिसिन के लेवल तक का कुछ सीख लो, तो या 1 या 2 साल भी काम कर लो, और कोई डिग्री करने से या कोई डिप्लोमा, चाहे वो वैलिडेटेड हो ना हो, आपके नाम के आगे कुछ एक क्रेडेंशियल तो जुड़ जाता है। मैंने जैसे डिप्लोमा इन इमरजेंसी मेडिसिन किया था, वो 1 ईयर का था, क्योंकि मैंने कहा पहले मैं 1 साल वाला करके देखता हूँ कि कितना आता है, या फिर है ना। तो वो मैंने किया था, जिसको कहते हैं टेस्टिंग वाटर्स, क्योंकि तब तो ज्यादा लोग नहीं थे। तो बट आई फेल इन लव आफ्टर 1.5 years. It took me 1.5 years to fall in love with emergency medicine, but then I fell in love. So that was one diploma या fellowship की इतना करने से, अब उसके बाद भले if I had gone to any other specialty, but I will still have that कि हाँ I had certain skills so as to deal with this. Now if you have completed, ये तो 1-2 साल की हैं, but जितना टाइम आप स्पेंड करते हैं, जिसको कहते हैं कि 3 to 4 years इंडिया में मिनिमम, जैसे एमडी उसके लिए, यूके वगैरह में जैसे 6 years की, हाँ 3 years प्लस और 6 years का ट्रेनिंग पीरियड मानते हैं, ऐसा है। तो उसमें मेंबरशिप और फेलोशिप, या फिर आप उसमें स्पेशलिटी कंसल्टेंट बनते हो। पर ये यहाँ का कई लोग जो एमआरसीएम कर लेते हैं, वो मैं मतलब लॉट ऑफ देम आर एलिजिबल टू कम इन यूके if they are cleared by GMC, and they can continue working there, and they work। आप प्लैब के बाद जब आप आते हो यूके में, तो आप एक पोस्ट एमबीबीएस के लेवल पे आते हो, एसएचओ लेवल पे आते हो, जूनियर डॉक्टर। एमआरसीएम करने के बाद आप एक मिड लेवल रजिस्ट्रार के लेवल पे आते हो। अब फील्ड के अंदर जैसे अब फेलोशिप्स जो हैं, अगेन आप जो आपके इंटरेस्ट पे डिपेंड करता है। मेरा इंटरेस्ट थोड़ा सा सिमुलेशन बेस्ड एजुकेशन के ऊपर रहा है। तो जैसे टीचिंग बाय इटसेल्फ, अगर आप टीचिंग ही कर रहे हो, अगर आप किसी कॉलेज या यूनिवर्सिटी से जुड़ के और वहां पे आप कुछ लेक्चर्स देते हो, वेरी गुड। आप इसमें जैसे बताए सिमुलेशन बेस्ड एजुकेशन हो गया, टीचिंग हो गया। इसमें कुछ लोग अगर आप अगर स्पोर्ट्स मेडिसिन में अगर इंटरेस्टेड हो, तो शायद उनमें भी फेलोशिप होती है। माउंटेनियरिंग या एक्सट्रीम प्लेसेस की मेडिसिन की हाई एल्टीट्यूड्स पे आप इमरजेंसी केयर प्रोवाइड कर रहे हो, या फिर people have also worked in क्योंकि in cruises or worked in you can with these qualification, like the possibilities are many, like I had colleagues who had worked with airlines as their, क्योंकि उनको क्या चाहिए होता है कि हाँ एक एमबीबीएस तो हो, है ना, उसके बाद अगर उसको और इमरजेंसी मैनेज हो जाए क्रूज वगैरह में, क्या है अगर आपका तो आप किन्हीं सो यू कैन वर्क एंड देयर आर इसमें होती हैं फेलोशिप्स, नॉट एट द टॉप ऑफ माई माइंड कि क्या है। फिर आप जैसे रिसर्च में करना चाहते हैं तो इंडिया में अभी बात ये है, आप जो भी फेलोशिप जो आप करें जिस भी चीज में, यू इफ यू आर, इट शुड नॉट कम एज कि अच्छा ये फेलोशिप है तो ये कर लेता हूँ। अल्ट्रासाउंड में भी होती हैं फेलोशिप्स होती हैं, तो फील्ड के अंदर ही इतनी सारी वो हैं, एंड दे मे बी मच मोर। अब तो टेलीमेडिसिन या कुछ भी आ गया, तो इशू या प्री हॉस्पिटल केयर अगेन, जिसमें एविएशन प्री हॉस्पिटल भी है कि आप एयर एम्बुलेंसेस के साथ काम करते हैं, तो पॉसिबिलिटीज लिमिटलेस हैं। बट आप फेलोशिप किस चीज में करते हो आफ्टर योर बेसिक थिंग, इट शुड आई थिंक बी डिक्टेटेड बाय योर ओन इंटरेस्ट। आपका इंटरेस्ट किस में है या किस चीज में बहुत ज्यादा अगर आपको स्कोप दिखता है, उस पे होना चाहिए। इट शुड नॉट बी लाइक ये चल रहा है तो ये कर लेता हूँ, वहां पे अब आपको फोकस करना चाहिए, अच्छा मैं ये कर रहा हूँ ये चीज इस रीजन की वजह से। तो बहुत सारी इंटरेस्टिंग अपॉर्चुनिटीज हैं जितनी मैंने आपको बताई। विल्डरनेस मेडिसिन कहते हैं, स्पोर्ट्स मेडिसिन हो गया, मतलब यू कैन ऑल्सो चूज टू वर्क एट अ वेरी एग्जॉटिक प्लेस, और वहां पे आप कह सकते हो अच्छा मैं इतनी इमरजेंसीज प्रोवाइड करूंगा पर मैं इतने एल्टीट्यूड पे दे रहा हूँ, तो मेरे को है ना लाइक
लिमिटेड चाहिए।
जरूरत, आप ये देखो जरूरत हर जगह है ना, क्या पहाड़ों में जरूरत नहीं है, क्या वहां जरूरत नहीं है, मतलब इमरजेंसीज तो कहीं पे भी हो सकती हैं। तो जहाँ पे आप वो जरूरत का इकोसिस्टम को आप बोलो कि मैं इसको यहाँ पे इतने लेवल पे मैनेज करूंगा, दैट इज ग्रेट, मतलब यू हैव डन अ गुड जॉब देयर।
This is very interesting to know the kind of scope, that people can avail with this branch. So now now you have moved internationally. You are there in UK, working in one of the prestigious places. So how has your experience been working in India and in UK? How is it different?
तो फील्ड के बेसिक्स जो हैं वो सेम रहते हैं, ठीक है। फील्ड के बेसिक्स जो हैं कि इमरजेंसी मेडिसिन का पर्पस एज सच, और इसमें जो एक ये चीज आती है जो बेसिक में ये आता है कि जब मैंने एमबीबीएस किया था ना, एमबीबीएस के बाद एमबीबीएस आपको थोड़ा मेडिसिन के स्ट्रक्चर से सिखाया जाता है कि आप पेशेंट को पहले आप आता है तो पहले उससे हिस्ट्री लीजिए, विदाउट इवन टचिंग द पेशेंट आपको 50% मालूम हो जाना चाहिए। हिस्ट्री लीजिए, फिर एग्जामिन करिए, फिर ट्रीटमेंट दीजिए। सबसे बड़ा चैलेंज इमरजेंसी मेडिसिन में मेरे को ये आया था, पेशेंट अभी गैस्पिंग करता हुआ अनकॉन्शियस आया है, तो मैं हिस्ट्री पहले लूं, एग्जामिन पहले करूं, या इसको ट्रीटमेंट पहले दूं? तो ये तो उल्टा हो गया, मेरे को ट्रीटमेंट पहले देना है, फिर मैं एग्जामिन करूंगा, और फिर मैं बाद में हिस्ट्री लूंगा।
करेक्ट।
तो वो जो बेसिक है, टीम के साथ काम करना, पेशेंट को देखना, जिसमें आप देखते हैं कि आप रिसोर्स लिमिटेड और डिजास्टर, अभी जो आप फेलोशिप की बात करें तो उसमें डिजास्टर मैनेजमेंट भी है, ठीक है, वो भी होती है। तो आप इन सब फील्ड्स में आप और अपने आप को एक्सप्लोर कर जा सकते हो। और बात ये सारी फील्ड्स अपने में न्यू हैं, तो आपको कई बार यू विल हैव टू लुक अप इंटरनेशनली, यू विल हैव टू रीड अप सम बुक्स, अगर आपको कोई फॉर्मल या इनफॉर्मल रिकग्निशन चाहिए, और यू विल हैव टू बी गाइडेड बाय योर ओन इंटरेस्ट। बट एज लाइक यू कम टू यूके, तो मैंने बताया कि बेसिक इमरजेंसी मेडिसिन का स्ट्रक्चर या अप्रोच आपकी पेशेंट की वैसे रहती है, जिसमें एक रहता है क्लिनिकल स्किल्स वाला, क्लिनिकल मैनेजमेंट ऑफ द पेशेंट। द सेकंड बिट इज कि जैसे वर्किंग इन टीम्स, और आप करते क्या हो इमरजेंसी में कि आप बेसिकली इन सम वेज यू व्हाट यू आर डूइंग इज रिस्क मैनेजमेंट। आप पेशेंट को का सारा ट्रीटमेंट नहीं कर सकते जब वो इमरजेंसी में आया है। अगर उसको 6 साल से बैक पेन है, तो अभी अगर वो बैक पेन में आया है तो आपको ये देखने की जरूरत है कि ऐसा तो कुछ नहीं हो गया उसकी बैक में जिसमें अगर अभी नहीं ट्रीट किया तो मतलब it will not cause any death or disability. Is it an acute condition? Does it need the treatment now? So these are the questions that you ask in emergency medicine, because you can't treat the patient as a whole. It is not like internal medicine that you are following up the patient.
Correct.
कि ऐसा this is what we need to do, ऐसा आप follow up के लिए आना, बाद में फिर आना. You don't follow up, you treat immediately.
Yes.
Those kind of things are, as a uniformity in emergency medicine across the world, will be same. कि आप what you do, try to do so you do risk management. You say okay, आपको chest pain हुआ था, हमने ये सारा ट्रीटमेंट और ये टेस्ट करे, हमें लग रहा है आप ठीक है घर जाने के लिए, तो अब आप घर जा सकते हैं. तो या फिर मतलब in essence what we try to do in emergency is basically see कि either we are treating you for something acute or life threatening, or we are ruling that out.
Correct.
So this is what, तो हम डिसाइड करते हैं कि अच्छा आप अगर आप पेशेंट अभी भी पूरा ठीक, तो हमको सेफली डिस्चार्ज के बारे में सोचना होता है, हमको सेफ ये सोचना होता है कि ये पेशेंट को एडमिट करना है या इसका अक्यूट मैनेजमेंट होना है. तो ये चीजें कट अक्रॉस कंट्रीज बिकॉज दिस इज द फील्ड इटसेल्फ.
Correct.
The differences is in India and UK is India by itself is like multiple countries together. मतलब जो एक ही शहर में किसी एक हॉस्पिटल में जितने कितने लेवल का ट्रीटमेंट मिल रहा होगा, दूसरे जगह में कहीं पे भी वैसा नहीं मिल रहा होगा. मतलब वर्ल्ड अपार्ट हो सकते हैं वो, वर्ल्ड अपार्ट. तो वेयर यू वर्क इन इंडिया उससे बहुत फर्क पड़ता है. और लार्जली ये कहूंगा कि इंडिया में क्योंकि डिपार्टमेंट्स अभी इवॉल्व हो रहे हैं ना, तो वो भी इस पे कि आप बहुत ही रिसोर्स लिमिटेड कहीं कोने में अगर आप हैं, तो you will be probably doing all the emergency interventions on the patient, whereas and you probably do a lot more in India as work wise, and the different kinds of patients you see, the interventions that you do much more. But in UK you because there is a lot of specialty input at different levels, so कई सारा काम आप जो है स्पेशलिटी पे, मतलब आप बस इमरजेंसी वाला करके फिर आप इमरजेंसी का इनपुट लेते हो, विच अगेन मतलब इज डिपेंडेंट ऑन वेयर वी आर. सो in UK the case different, there are cases that are different, but how you grow as a I think in working hours का difference है, working hours का difference है, and work there is a difference of थोड़ा सा जैसे work life balance में थोड़ा सा शायद यहाँ पे offs थोड़े ज्यादा मिलते हैं, बट वो भी एक जैसे जैसे आप सीनियरिटी में ग्रो करते हो, जूनियर डॉक्टर्स को यहाँ पे भी काफी हेवी हेक्टिक आवर्स रहते हैं. तो एंड ठीक है. और बाकी इंडिया की अपनी ब्यूटी है, इंडिया के अपने रिस्क्स हैं हॉस्पिटल्स में काम करने के आजकल, एंड ये तो है ही. तो यहाँ पे थोड़ा सा सपोर्टिव उस तरह से ज्यादा रहता है. कोई आपको आके एक सिक्योरिटी वाली वो जो चीज है कि कोई ऐसा नहीं कि हॉस्पिटल में आपको कुछ कर देगा, है ना. तो एक इमरजेंसी मेडिसिन का एक जो कई लोगों को डर लगता है कि हम इमरजेंसी हाई वोल्टेज एरिया में काम कर रहे हैं, हॉस्पिटल्स को और गवर्नमेंट को उस एरिया में कि वो सिक्योरिटी प्रोवाइड करनी चाहिए. नोबडी कैन वर्क इफ दे आर फीलिंग इनसिक्योर, सो दैट शुड बी गिवन. बट ओवरऑल पे एंड ऑल दोस थिंग्स ठीक है, लॉट ऑफ थिंग्स आर टेकन केयर ऑफ हियर, बट in India it is not like you will be fighting for essentials. You get a decent job and a salary after you've done emergency medicine, is what I've seen my seniors and my juniors and my colleagues to see, that ऐसा नहीं कि कोई struggle उस से हिसाब से बहुत करता हो. Yes, हाँ, grow करना सब चाहते हैं, तो वो एक हमेशा रहता है कि can I do more. In India, there are a lot of opportunities in a lot of areas, bigger cities, smaller cities. So that is there. Here it is, you are working in a more structured manner, in a more secure environment.
That's true. That's completely true. So now, when you are settled there, working also as an academician, what I know, along with a practitioner, how do you think challenges have been different in India and there, or in general, what are the kind of challenges with the branch? Obviously, you have mentioned a bit, because high voltage है लोग,
नहीं, वो टोल रहता है. इनफैक्ट आपका क्वेश्चन किसका, मतलब एज क्लिनिशियन के चैलेंजेस को.
एज अ क्लिनिशियन, सॉरी, आई जस्ट एज अ क्लिनिशियन, कि अगर कोई इमरजेंसी मेडिसिन में काम कर रहा है तो क्या चैलेंजेस होते हैं एज अ क्लिनिशियन?
ऑड वर्किंग आवर्स, उसको आप मतलब एक लाइफ के एक सर्टेन एस्पेक्ट तक आप उसको आराम से कैरी कर लेते हो, पर उसका फायदा ये होता है कि ऑड रेस्टिंग आवर्स, ठीक है, ऑड रेस्टिंग आवर्स मिलते हैं आपको. जब दुनिया 9 to 5 में बोरिंग तरीके से काम कर रही है, तो आपको कोई कोई डेज ऐसे ऑफ मिलते हैं जिसमें कि आप ऐश कर रहे हो, ठीक है, मतलब ठीक है, रेस्ट मना रहे हो, ऐश भी चलो ठीक है, कभी कभी कर सकते हो. और तो odd working hours, odd resting hours. I think after there is now this risk in smaller setups और in second जहाँ पे अगर security ना मिले तो वो वाला risk का एक challenge है जो कि as soon as possible address होना चाहिए. Although उसमें एक communication का बहुत बड़ा रोल है जिसको शायद हम इस टॉक में कवर नहीं कर पाए, but जिसमें it is an entire topic in itself, like the things that I told you, like your ability to communicate, your ability to manage and triage the situation, or your ability to teach. These are some essential things that are required for you to grow, and this can be entirely different talk कि ये चीजों को कैसे develop करे एक doctor in order to grow.
Correct.
But as a clinician, आप मतलब ये जब आप कम्युनिकेशन और ये सब चीजें अच्छे से करोगे तो इंसिडेंट्स भी कम होते हैं, आपकी लाइफ बेटर बनती है. तो आप कहीं पे भी काम कर रहे हो तो उसके चैलेंजेस आप खुद ही देखते हो. आपके काम, आपको ओवर टाइम काम करना पड़ रहा है, सो यू विल फाइंड कि मैं कैसे इस चीज को बेटर हैंडल कर सकूं. सो वो एक कांस्टेंट चैलेंज रहेगा इमरजेंसी फिजिशियंस के लिए. वाइल ऑन फ्लोर एक रहता है कि आप, मेरे ख्याल से आप सीखते हो पेशेंट को रेफर करना है, तो कई बार आप पेशेंट के एडवोकेट होते हो, कई बार आप हॉस्पिटल की तरफ, कई बार आप दोनों लोग के, यू आर कम्युनिकेटिंग टू योर टीम, यू आर कम्युनिकेटिंग टू द पेशेंट, यू आर कम्युनिकेटिंग टू द पेशेंट पार्टीज, यू आर कम्युनिकेटिंग टू द बैकडोर्स ऑफ कि स्पेशलिस्ट मना कर रहा है कि नहीं ये पेशेंट का, और पेशेंट कह रहा है नहीं मेरे को एडमिट होना है, और वो कह रहा है, हॉस्पिटल कह रहे हैं कि हमारे पास कैपेबिलिटीज नहीं है. आप उस सिचुएशन को कैसे डिफ्यूज करते हो? So a lot of these things that you have to handle.
That is management. Yes.
तो ये सारे challenges आते हैं. तो मैंने जैसे देखा कि ये फील्ड में मैं टीम के साथ, मतलब ये सारे इसके साथ के challenges हैं इमरजेंसी फिजिशियन. जब मेरे ख्याल से ये कुछ ऐसी चीजें हैं जो रहती हैं फील्ड के साथ यूनिक हैं. मेरे को एक फीलिंग जो बिल्कुल नहीं अच्छी लगती है वो कि जिसको कहते हैं कि एकदम फीलिंग कि अरे मतलब फीलिंग एंशियस कि पता नहीं क्या पेशेंट हो जाएगा. तो जब आप इमरजेंसी मेडिसिन में होते हो, यू आर ऑलवेज ट्राइंग टू ओवरकम कि मेरे पेट में बटरफ्लाइज क्यों है, अभी पेशेंट का कैसे बेटर मैनेज करूं, क्या, हाउ डू आई प्रिपेयर माई सेल्फ. तो आपकी बैंडविड्थ भी हमेशा ऐसी रहती है, आपके सोचने का तरीका पूरा बदलता है. क्योंकि जैसे बताया, ऐसा आप ये सोचते हो कि अगर मैंने अभी मेरे डिपार्टमेंट में 10 पेशेंट हैं जिनको मैंने अभी ठीक तरीके से मैनेज कर लिया है, बट अभी अगर बाहर अगर एक क्रैश हो गया और 20 लोग आ गए तो उनको मैं कहाँ रखूंगा. तो आप हमेशा एक ऐसी बैंडविड्थ अपनी हमेशा कि आर यू प्रिपेयर्ड फॉर द नेक्स्ट, अभी डिपार्टमेंट में कुछ ये हो गया, अभी कुछ. तो एज एन इमरजेंसी फिजिशियन यू आर ऑल्सो ऑलवेज प्लानिंग, प्रिपेयरिंग फॉर द अनफोर्सीन, फॉर व्हाट कैन कम नेक्स्ट. your mindset changes. You are always thinking कि मैं अपनी चीजों को प्रायोरिटाइज कैसे करूं, which is the patient. 10 पेशेंट्स को मैं साथ में जाके नहीं देख सकता, तो पहले 3 कौन से ऐसे हैं जिनको मेरा अर्जेंट अटेंशन चाहिए, तो वो आप प्रायोरिटाइज करना सीखते हो. आप रिसोर्स मैनेजमेंट, ये आपके दिमाग में ही चलता रहता है क्योंकि नेक्स्ट पेशेंट, नेक्स्ट क्राइसिस कभी भी आ सकती है. फिर पेशेंट आएगा तो उसको लेके भी आपकी अप्रोच अलग रहती है, क्योंकि पहले आप शायद ट्रीटमेंट करोगे, फिर एग्जामिन करोगे, फिर बाद में मालूम चलेगा कौन था. आप पुलिस केसेस, accident, injuries, cardiac issues, mental health, strokes, neurology, seizures, asthma, severe breathing difficulties, heart failure, uh, all joint dislocations, बच्चों के parents. You see all of these things in emergency medicine in the ultimate crisis. So challenges बहुत different तरीके के हैं, but it is a it is like I think a time has come that people also choose emergency medicine, understanding this field better. I hope whatever we have discussed helps people get a little more clarity. I'll be happy to clarify any further questions as well, if they have to ask any focus specific. This was just ki there is a lot of scope. It teaches you a lot about life. आप किरदार जो है बदलते रहते हैं, डॉक्टर्स बदलते रहते हैं, टीम बदलती रहती है, पेशेंट बदलते रहते हैं, पर शो जो है 24/7 चलता रहता है. तो yes, it teaches you a lot as well.
So in the end, let's end this on a high note, understanding ki something that you want to tell the postgraduate student who are doing emergency medicine, or for those students who intend to pursue this branch after listening to this talk. Now, how there are so many opportunities available in the branch. So anything that strikes your mind that you want to suggest them.
एक तो मैं सारे डॉक्टर्स को और जितने भी सुन रहे हैं, तो उनको मैं एक तो ये बात बोलूंगा कि जो रीजन शायद मेरा जो था इमरजेंसी मेडिसिन लेने का, वो जो डर था कि आप कोई भी स्पेशलिस्ट बनो, सॉरी, आप कोई भी स्पेशलिस्ट बनो, बट थोड़ी सी इमरजेंसी का मैनेजमेंट तो सीखो, जानो. ऑफ कोर्स जो चीज आप डेली करते हो, अगर मैं डेली में, तो वो एक डिफरेंस रहता है. वो जो एक स्पेशलिस्ट है इमरजेंसी मेडिसिन में, वो उसको डेली देखेगा, बट स्टिल नो अंडरस्टैंड एटलीस्ट फर्स्ट एड को पकड़ के रखो अगर बाकी इमरजेंसी भूल जाओ तो. तो एक तो ये है कि डॉक्टर बन गए हो, चाहे अपनी फील्ड में भी आगे बढ़ रहे हो, कई स्पेशलिस्ट होते हैं भाई, वो दे आर नॉट सीइंग दोस काइंड ऑफ इमरजेंसीज एवरी डे, है ना. तो दे आर ऑल्सो नॉट यूज्ड टू हाउ टू हैंडल. बट I would say इमरजेंसी मैनेजमेंट को अपने साथ रखें, एक तो. दूसरा, इमरजेंसी medicine as a field helps you challenge yourself in a lot of ways, in a 360-degree way. It helps you see patients, their needs, understand life, understand death in a most you will always have the best stories and the most crisis worthy stories. मतलब सबसे odd और most interesting stories होंगी आपके पास. आप को people person भी बनना पड़ता है, भले आप कितने, आपको it challenges you to become an educator, it challenges you to become better speaker, it challenges you to connect with people, it challenges you to manage situations, it challenges you to understand the most critical aspects of life-saving interventions.
Correct.
So it challenges you on a very 360-degree level, I feel, and it helps you become a wholesome person. I mean, a complete person as a whole. So yes, तो ये दूसरा point होगा. And lastly, I guess अभी के लिए दो ठीक है. बाकी लोगों को अगर कुछ हाँ, और and life of course takes you to different places. There is no utopia. ऐसा नहीं है कि अगर आप अभी एक स्टूडेंट है जो स्ट्रगल कर रहे हैं, तो वो भी एक टाइम है, उसको भी आप रिलिश करेंगे बाद में, याद करते हुए. इट इज समथिंग दैट मेक्स यू, बिल्ड्स यू. बट ऐसा मत सोचो कि कोई चीज होने के बाद कुछ एकदम वहां पे यूटोपिया है, कहीं फॉरेन में यूटोपिया है, या इस जगह ये ऐसी जॉब. आप जहां हो वो यूटोपिया है. अपने आप को यू ट्राई टू ऐसा मत सोचो कि बस अब लाइफ को भी मैं पोस्टपोन कर रहा हूँ. आप जो कर रहे हो उसको आई थिंक try to be that person all the time who is in the moment and knows what he is doing in that moment. तो थोड़ा टाइम निकालो समझने के लिए कि करना क्या है, और उसके बाद करते चलो, एंजॉय करते चलो. आई थिंक यही है. बाद में सब समझ में आता है कि मेरी स्पेशलिटी ही ठीक है, वो आपकी लाइफ रहती है, थोड़ा आप अपनी स्पेशलिटी बनते हो, यही लाइफ है, ऐसे ही. तो इट इज अ गुड स्पेशलिटी, एंड I wish all the best to the listeners, and if they can take something out of it.
No, completely. So, ending this on a very important message of life also is thank you so much. I'm sure this message will definitely motivate so many students out there to understand the immense opportunities that emergency medicine gives you, where all you can work, and understanding that emergency medicine is something that is everywhere, everywhere, wherever you go. And so the kind of opportunities it gives you is immense. And so there are trade-offs in every branches, so it has also. So what you can adjust with, what you can go for, and understanding this, if you want to go for this, is something we are trying to discuss and want to help you understand. So do share this with your friends and colleagues also if they want to pursue emergency medicine. This being a new branch is not very saturated, so actually it gives you a different kind of opportunity, settle down in a better place in a better way, as well as giving you a better pay scale. So just look into it. If you are on that stage of picking up your branch for your post graduation, do look into it. It can be an amazing way to settle down in a better way. So thank you so much, Dr. Akshay, to help us understand about this branch. I'm sure this will help in a very good way for the students to understand about the branch and pursue it. Thank you so much.
Thank you, Ayushi, for
Thank you
having
so
me.
much, everyone, for discussing this, for actually staying with us and listening to this talk. I'm sure this would have helped you. Do also follow us on our Instagram and YouTube channels as well. There you can find all our old videos that can also help you with your career growth. And in case of any doubt with emergency medicine, if you want to connect with Dr. Akshay, you can definitely connect with us. We will help you with that as well. And if you want a video from him of settling down in UK, how did he land up into a job into UK, into the Oxford hospitals, do let us know. We'll definitely get back to him and get that video as well. Thank you so much, everyone. Thank you, Dr. Akshay, again.
Thank you, Ayushi.